You can change and improve the shape of your face by simply changing some habits that will be covered in this video. The bones of the skull are held together by fibrous joints called sutures. This allows for some movement between these bones, and many things can cause an asymmetrical development of your face throughout the years. Human beings have evolved to notice facial symmetry and associate it with a healthy individual who has not suffered accidents or malnutrition. But how do we know what factors affect an asymmetrical development of our faces? How much of our genetics are involved versus our daily habits? A study conducted in 2014 evaluated 147 pairs of identical twin brothers to know which factors altered facial symmetry. Since identical twins share the exact same DNA, it's only up to their habits to determine the differences in their faces. The study determined that the twin brothers who slept on their stomachs suffered a greater deviation of their noses and mouth corners compared to their siblings who preferred to sleep on their back or on their sides. Additionally, twins who smoked or had a tooth extracted had a side of their mouth more descended than the other. So your best options are to sleep on your back or on your side, avoiding smoking and maintain your dental health. So we know that facial bones can be moved by passive forces, such as our sleeping position. But what else can move our bones? The same thing that moves every other bone in our bodies: muscles. This is essential to face symmetry, since muscle development and muscle tension in the face, mouth and neck are a big factor when it comes to moving face bones. For most of its evolution, especially in the Paleolithic, the human species found much harder to chew foods than we eat today. This caused two things. In the first place, this produced more developed chewing muscles, and secondly, a wider dental arc and more developed jaws. These are positive things, since the more space there is in the mouth cavity, the less teeth alignment problems a person will have, which includes wisdom teeth problems. The tongue, which is a very strong muscle, plays a central role in the development of the palate and jaw, applying force from inside the mouth. The correct posture of the tongue pushing against the palate helps guiding the maxillae bones forward and sideways. When you have respiratory allergies or difficulties to breathe through your nose and instead you breathe through your mouth, it becomes impossible to maintain the correct tongue posture. This prevents your face from growing forward, and in fact it will grow in the only direction it can, downward. This may cause you health and aesthetic problems. Correcting your tongue's position will help you breathe better and through your nose, especially when sleeping. You can test your tongue's position by swallowing. Position your entire tongue against the palate and make sure the tip is in contact with the palatine recess. Make sure your head is straight and swallow in this position without touching your teeth. Can you feel how hard this deglutition is compared to the way most of us are used to doing it? How important is it to not push your teeth forward when swallowing? According to this study, muscle forces of only 1.7 grams are capable of moving teeth. Moreover, your tongue is capable of applying up to 500 grams of force, which will definitely contribute to shaping your face. One of the most effective methods of improving the tongue's posture is a technique called mewing, invented by Dr. Mew. I will leave a link in the video description so you can learn this technique. Have a nice day, my friend.